Good evening, ladies and gentlemen. We'd like to start this evening's meeting of the Strategic Planning and Environment Overview. Strategic Planning and Environment Overview and Scrutiny Committee, if I can get the title correct. My name is Councillor Anderson. I chair the committee. Before we start the agenda, can I ask members if we could move we have some external folks who come to speak to the item, whether we can bring the health campus item forward to the start of the meeting. Is that agreed? Agreed. Thank you. If anybody mentions anything in part two, sorry, let me rephrase that. Can I ask members to avoid asking anything that's part two? If they really need to ask a question that's part two information, we'll have to park it and deal with it at the end of the meeting, after the guests are no longer here. But I hope we can deal with part one issues only under that item. Yes.
We can move into part two on that item, but if we could keep all part twos together.
Yeah, we'd have to cart people in and out of the room and out and in the room and all that. Yeah, hopefully we're worrying about something that's not going to happen anyway. Item one on the agenda, decisions, to agree decisions of the previous meeting. Is that agreed? Agreed. Thank you. Item two, apologies for absence.
We've received apologies from Councillor Patterson.
Apologies from Councillor Patterson. Are there any other apologies? No. In which case, item three, declarations of interest. Any declarations of interest? No. Item four, public participation. There being none. No. Item five, consideration of any matter in relation to calling. There being none. So, item 5A, I think we're going to call it, originally numbered as item 13, Hemel Health Campus. I'll hand over to Mr. Southern, who's going to introduce the item.
Thank you, Chair. Just a brief introduction. We'll take the report as read. It's quite a lengthy report on the appendices. Just a couple of points of introduction. In terms of next steps, this moves on to governance for us to Cabinet on the 18th of November. The week before that, it goes to the Hospital Trust Board, and the week after that to the ICB Board. I think for approval. Just to stress that the Cabinet report does not commit the Council to anything beyond supporting the submission of this draft business case to NHS England and Treasury to submit to NHS England and Treasury, sorry. So there are no financial or other implications of that report at this stage. Any future decisions will come as and when necessary to future meetings. So I think it's just important to point that out in terms of the recommendations that will be in the Cabinet report. And I think if I can just hand over to Sheena, who's going to say a few additional words.
Please.
From the health.
It's lovely to be here. Thank you very much. My name is Sheena Phillips. I'm Programme Director for Hemel Health Campus. It's great to be working in this partnership that we have with Hemel to produce the Hemel Health Campus strategic outline case. And the partnership is Hearts and West Essex ICB, yourselves, and West Hertfordshire Hospitals Trust. You've read the paper. I'll just say a few words just to kind of refresh your memories and the content of that paper. At the heart of this is actually building a building called a neighbourhood health centre, and that language is quite specifically chosen. It's actually language that very much falls in line with the 10-year plan that was published a few months ago, promoting the idea of neighbourhood health, the idea of community engagement, and delivering services that are actually about keeping people out of hospital and managing their care in the community, but also then the provision of secondary care services. So in response to an ageing population and a growing population decorum, in response to the challenges with the estate currently on the Hemel Hospital site, this SOC is actually proposing a preferred way forward, and this language is very specific to the writing of a strategic outline case following Green Book guidance for Treasury. And that preferred way forward would be to build a new building, a purpose-built building in Market Square, so just down the hill from the campus. What you've got in this document is of the 5 cases, so it's the strategic, economic, commercial, financial and management cases, setting out the argument and the analysis that's been done to actually arrive at that preferred way forward. We've also done an extensive stakeholder engagement process. We had 8 meetings, we've done staff engagement, we've met the voluntary sector as well, And we've also done an online survey, and we had, I think it's now actually only it was 8,000 people visited the site, and 750 or so actually responded to the survey. So we've spoken to a lot of people, gathered a lot of information, and people are broadly in support of this. There are still calls for the wish to build a fully functioning hospital on the Hemel Hospital site. But we took this paper to the Health and Wellbeing Board yesterday, and there was a clear discussion on the opportunities. And those opportunities are really a purpose-built building, a co-location and adjacency of multiple services, an increase in outpatients, diagnostics and same-day services, full endoscopy suite provision, proactive care models, so using this building as an opportunity to bring in innovation. And proactive care is actually reviewing records and finding patients at risk of hospital admission and providing wraparound services to prevent them admitting to hospital. It would be on the high street, access to public transport, not having to climb the hill to get to Hemel Hospital, and there would be no decanting of services. And by decanting, that means that actually building a purposeful building, we would still continue to provide services in Hemel Hospital. Once the building is open, we can then move services down. The options to refurbish would mean actually quite complex decanting and moving out of services and moving back in of services. When we presented this to the Hemel Hospital staff, there was 225 staff joined a Teams call. I was quite taken aback by the number of people on the call. And I was also taken back by how much they supported this approach. And these are people who also live in Hemel Hempstead and have family in Hemel Hempstead. They think it's a no-brainer, was the language actually in the chat, to have it in Market Square. This is brilliant. Frail people not having to go up the hill, easy access to services. Wow, how fantastic, a new building for us to work in, purpose-built, arranged and designed around our needs to actually work with our patients. This is a wonderful, when are we going to get started? So I'm very happy to take any questions. Thank you.
Councillor Timmins.
Thank you very much for the presentation. The one thing you haven't mentioned is parking. You mentioned that the majority of the expectation increase in patients would be those for elderly. Now, I would suggest if you've got elderly people coming in, then having no parking, but parking at a distance and in the, I can't remember the name of it now, waterfall gardens. Water gardens, which is already pretty busy and parked up. So I would have thought that that is the one thing that I would say against it. And on the other hand, I would also say you've already got facilities up there and car parking in the existing hospital. So why start all over again? And instead of, you could easily just improve, update facilities in the hospital itself. It seems to me that the parking is the crucial thing. And for most people coming to hospital, they do need to come by car. Some people will be able to come by bus, but really when you're not well, it's something that I think is pretty important, especially if you've got small children and this sort of thing with you.
I'm really glad you raised that. It was actually something when I presented to our GPs, they addressed the same issue as well, the parking, and it's also an important aspect for people attending outpatient appointments. The last thing we want is people not attending an appointment because they couldn't park the car. We are meeting with BD, one of the architect organisations supporting us to actually do a very high-level review of parking provision and opportunity and a calculation to help understand better the picture of parking. What we want to look at is the level of footfall in the building and therefore what is the expected amount of parking that would be needed for that, and then also producing a parking strategy in Hemel Hempstead. So I'd like to, if any of my decorum colleagues would like to comment on parking.
Yeah, just to say that there has been some preliminary analysis of parking, and it's not at capacity at Water Gardens at present, so there is scope, but as Sheena says, there's more work carrying on that.
You've also got staff to consider, and I assume that they too, I mean, you can't guarantee that they're just living around the corner. So I think that's a major consideration before you can sort of look to the future. I can understand that it's easier to put in a brand new building and therefore design everything and put in the latest equipment, etc., etc. But I do think that is something that is crucial.
Absolutely, and that's noted. But yes, at high level, the analysis is that there would be capacity, and obviously, you know, there is scope to increase the capacity there if that were needed. And it's level access, but that has all to be done. Remembering this is the strategic outline case as well, and we will go into much more detail as we get to the outline business case and looking at drop-offs as well and the rest.
I think it's something that should be in place before you go ahead with it, really. Because, and also when you think about people arriving in wheelchairs and all this sort of thing, you know, they don't, you know, ideally need to have to come down to levels of a car park and this sort of thing. Anyway, that's my point. Thank you.
Councillor Whitelow.
Thank you, Chairman. Thank you for the report. Yes, it would be lovely to have a nice, bright, shiny new building on that site. I'm quite sure that the very firm commitment coming from the council. I'm not so sure about the commitment of the NHS to this. They have a record of not producing projects that, you know, for example, glaring one is the Watford Hospital situation, where they spent so long trying to bring that to fruition against, you know, the teeth of the local opposition. The government has now moved the goalposts, and they won't even begin to consider rebuilding Watford Hospital until 2035. And you know, if this scheme, how sure are you that the finances are in place? What is your timescale for realistic delivery? And I do share Councillor Simmons' concerns about parking. It's no good saying, but it's on level ground and the bus stops are all there, when the outlying communities like my own, Woodall Farm and you know, Grove Hill, the bus service there is just simply not good enough. It doesn't turn up and all the rest of it. So you've got people who are being put off from driving into the town centre, who can't rely on the bus service, and yet you think that putting it there is a good idea. You know, I am hugely doubtful. You know, yeah, we'd love a new building, but I say there are, you know, two serious questions about NHS commitment to it, and also real issues about parking. You know, you just said you had 200 responses from members of staff. So clearly there is a considerable body of staff that will need parking as well. And I know you said you're going to do a study, but you cannot suddenly create the space needed unless you're then going to get involved in even more expenditure by extending the height of the current parking provision, which I don't think you can actually do in the water gardens, because I think it's grade 2 listed, isn't it? The water gardens themselves are grade 2 listed. Chairman, you will correct me, I'm sure, if I'm wrong.
I'll plead the Fifth Amendment on that one. But do you want to?
So the commitment for the NHS, gosh, I'm really excited to be working at West Hertfordshire Hospitals Trust. I'm really excited. There's a kind of the rag for the NHS, it's a magazine called the HSJ, and you know, we're in there quite regularly in terms of the forward thinking of West Hertfordshire and its ability to access funding for St Albans surgery hub, accessing funding for the proactive care model, accessing funding for social initiative, reviewing with Macmillan to look at actually cancer patients and how you manage their care. So under the guidance of Matthew Coates, I feel we're in a really, really strong position. We're also politically very networked in to the NHS England. I previously worked for NHS England. I'm meeting them next week to discuss this strategic outline case to pave the way for it to then be going up to Treasury. We want this case to take the momentum through, and that's as much about the hard work that goes into the production of the document, but then also the kind of political conversations that sit around that. So I feel really positive and that we're in a really, really good place. There's a really strong commitment as well from Toby Hyde, our Chief Strategy and Collaboration Officer, on neighbourhood health. and the opportunity and for West Hartford to be sitting at the forefront. So hence the strong language in the document on this being called a neighbourhood health centre, and that language also tapping into any funding that might come through from the 10-year plan. So we're pulling out all the stops. It's a really difficult climate, I'll admit that, but we're doing as much as we possibly can to review those funding options, and yeah, the commitment is there from the NHS.
Can I just make a comment?
Well, hang on just a moment. You asked two questions, I think, didn't you?
I can't remember in the flow.
Right, okay, come back then, councillor, please.
Yeah, it's just that I fully support the concept of prevention and keeping people out of hospital. Totally agree that is the right thing that we should be doing, and the more we can do that, the better. I would love to be able to support the scheme, because of that very, the basic premise of that. But I can't support this scheme, I don't think, because I'm really concerned about the constraints that we've already mentioned about parking, which, why the hell should parking put a kibosh on a really good scheme? But unfortunately, that's the times we live in. And you're not going to get everybody walking, particularly your frail elderly, no matter how much we, I'm thinking about the active community strategy here. But yeah, let's get everybody moving if we can. However, some sections of the population are not, as Councillor Tim is so powerfully talked about. They are not going to be able to access these facilities. And we're going to spend all that money, then let's spend it in a way where we can access it to as wide a section of the population as we possibly can.
Can I bring in Diana?
Yeah, sorry, thank you. Just a couple of points picking up on the parking and the funding point, which I think was the second part or first part of your question. And Sheena can add to this. To give assurances, the parking point is important to us as officers and to everyone. And we have made it really clear that that has to be part of the solution. But I think as Catherine mentioned, it has to form part of the decision-making process. As Catherine said, though, this is the first stage of the NHS process in terms of business cases. So what has been addressed as part of this business case is what's needed to be addressed to take us through the first stage. But we do recognise and we do discuss the parking needing to be addressed as part of the next stage of the business case if this first business case stage is approved by the Treasury. So I just wanted to give assurances that it isn't something that we are not taking seriously and we are taking lightly. We understand the need to address that. I think it was referenced in the Cabinet report back in July last year when we sought approval and gained approval from Cabinet to proceed with this in partnership with health colleagues. So it is an important part of the proverbial journey, but what has been addressed at this stage is what's needed to be addressed to meet the NHS business case process and the Treasury Green Book process. It doesn't mean to say it isn't being addressed and won't be addressed as part of the final decision making. In terms of the funding point, and I think as Toby responded to the question at Health and Wellbeing Committee last night, this stage business case needs to go through in order to have the conversations around funding to demonstrate that there is a scheme that can be taken forward. Again, I go back to the point that this stage business case is as it needs to be for the process that the NHS takes it through in terms of 3 or 4 stages of business case. So again, because you don't see it identified as you would expect at this point, it doesn't mean to say that it isn't part of the process. So just to give those assurances on both those points, but to have the conversations of the NHS, to have the conversations with their funding bodies, this business case needs to be approved to have and demonstrate that a scheme is deliverable or a scheme is possible to have those conversations.
Thank you. Councillor Gale.
Yes, thank you. Thank you very much for the presentation. It does look very exciting. Just as an aside, I mean, whenever you propose a building or a new project like that, parking is always going to be the issue. Whatever, if you're building a new church or a new football stadium, whatever, it's always going to be parking is going to be always one. But this might be I'm sure you will all have thought of this. I haven't thought of this, but in cities abroad, very often they park underground. There's underground car parks everywhere. I just wondered, just before I ask my more substantive question, if someone could address briefly whether that's a thing that might be possible. The crust is quite thick, and you can have lots of layers of parking if you go in that direction. But the other thing that I'm curious about is, to what extent is this campus going to provide primary care as opposed to secondary or tertiary care? I mean, is it all going to be GPs referring as if it's a hospital, or is it actually going to be more like a polyclinic or something, or more off the street, more sort of less rigid, less traditional ways of doing it? And the sort of, I might as well get in my other question as well. What sort of staff is going to be there? Are they going to be specialist consultants or paramedics? I mean, what sort of things are going to happen there? Are they going to be surgery operations, or is it sort of more paramedics kind of thing? If you could give me a bit more about that.
Well, let's talk about the clinical model first, the clinical approach you're doing. So this is the part that gets me really excited. So it's about delivery of our current provision of services in Hemel moving down the hill. But there's also the primary care element is really important, and it was a really strong. We had a clinical steering group that met fortnightly, and it was chaired by Pani Sisu, and it was Trevor Fernandez and another GP, and it was a multidisciplinary group that I ran. And they were adamant that we don't want to have a GP surgery in that building. We've got great GP surgeries across Dacorum, but we want, and it's something that's part of the language in the 10-year plan, is primary care at scale. So they talked about those patients that are difficult to control diabetics, or patients with COPD problems, where you need that, it's the kind of world that's in between GPs and hospital outpatient appointments. And actually where it sits is a really difficult no man's land. And what we want to be doing is strengthening GP skill sets, but also how we're actually working with our outpatients and managing outpatients more efficiently. Sorry. Is that okay?
So it's sort of in between. Yeah. It's still going to rely on GPs, basically.
Yeah, so GPs working, and it's looking at a much more integrated care. So talk about care integrations. The model is really where GPs can tap into diabetologists, respiratory consultants, cardiologists. So all of the outpatient provision is currently up the hill, down in this building. But how can we actually shape a model that's a much more integrated model? We'll be moving services from the Marlows into this building as well. So you'll have the Hertfordshire Integrated Diabetes Service actually in that building. So community services with Dr. Knight, who's the respiratory consultant, along with GPs who specialise in COPD, for instance, which is a respiratory illness, bringing that all together in one place. And very much the model as well as looking at multimorbidity, because the language very much in the NHS today is it's not single pathways. So I think of my mum, she's got COPD, a few other things going on, and what she needs is she doesn't need the respiratory consultant to see her. She needs actually a number of people wrapped around her to care for multiple needs that she's actually got, to keep her well, living her fullest life at home and going and seeing her friends and doing her voluntary work. That's what we're about. So it's bringing together, so we're looking at pathways much more, they call it multimorbid. And that's where the proactive care model is coming in, how we can stop a much more siloed approach to care and a much more integrated approach to care.
Forgive me, it still seems as though the GPs are kind of the gatekeepers.
Well, that's the model of the NHS.
That's still going to be very much within that.
Yeah. So, but what you will have is somebody coming into the GP and the GP saying, well, actually, your diabetes is difficult to control. You've been coming back and forth. I think you should actually go and see this lovely service up in Market Square, and you'll see a diabetologist who specialises in this area, and then you'll also see a community diabetic nurse who'll be able to support you, because actually they'll be able to give you a level of care that I, as a GP, am not specialist enough to know how to manage.
Just briefly, I can provide an answer. That's a question I can answer about the underground car park.
Oh, yes.
When we were looking to this new building, the new civic centre, we did look at undercroft parking, but because of the River Gate, the Environment Agency said a definite no. Environment Agency were completely ruled that out, forbade it. So unfortunately, we can't dig down to put the parking underground. So that's not an option. Sorry, Diane, you.
No, I was gonna make that point about the underground parking. Apart from that constraint, it is also very expensive. And would, if it wasn't for that constraint, it's not something we would necessarily have not looked at. But there is that constraint around the gate and the impact on Chalk Street. And, you know, I mean, clearly this whole process, if it goes through the approvals, is also subject to planning. I should mention. So, you know, but that is, I was going to make that point around that constraint.
Okay, this is the last one. Councillor Santa Maria, and then we'll, unless briefly after.
We've mentioned several times GP services, and in the report it mentions GP practices being at or near capacity, rising mental health referrals and increasing demands for elective and emergency care. Will the new centre provide any increased capacity? Will there be more staff? Will there be more bed space or more places for people to go? Otherwise, is it not just moving the current, because my understanding is we're just moving the current staff down the road to a new building. And yes, it will be, you know, I appreciate they support it because it will be a much nicer building and it will be more efficient having everyone in one space. But if you don't actually have more GPs or more mental health practitioners, how is it going to actually reduce those waiting times and demands?
So we will be increasing the level of provision of services. So for instance, if you go for an MRI scan at the moment, you go into a lorry, sit in the car park on the Hemel side, whereas we'll actually be, we're looking at the data to understand how many MRI scanners we'd actually have physically in the building, CT scanners, X-ray, non-obstetric ultrasound, all of these services, and yes, increasing the number of those equipment and yes, the staff to come with that. We're also looking at whether can the site of Market Square actually be the centre for medical specialties. So this actually would be the centre for dermatology, diabetes, cardiology, and so we actually bring and actually increase the level of outpatient appointments that are actually available on that site, and similarly for endoscopy as well.
Okay, but will there be any more mental health services, any more mental health practitioners or GPs?
Yes, so there'll be more moving some mental health services that are currently provided in Marlows into this building, and yes, we'd be increasing the staffing.
Councillor Hobson, very briefly, please.
Just really about, this can be left as a comment rather than a question if need be, but it does need to be said. So my inbox is quite full by people that are very dissatisfied with the consultation process and the lack of, so they feel that not being able to see the business plan makes it difficult for them to participate. But I did just want to make a couple of comments on the actual numbers. So early on in the report, it talks about 160, nearly 1,000 people in decorum, and then sort of crows about over 7,000 people engagements to the website. We've got only 750 complete surveys and only 400 people attended workshops. So that's a very small proportion of people in the community. And the highlights that you put in the pack as well, the 74% agreed with our aim too. They're all very leading questions. You know, would you like better healthcare? Would you like more staff? Would you like, you know, very few people are going to say, no, I don't want that. So, I mean, it's very slick, but I don't want anybody to leave this room thinking that the folks out there that feel very left out in this discussion and have felt very shortchanged for primary and, well, particularly secondary, and that in between healthcare for many, many years since the hospital basically closed and emergency care use moved to Watford. So I don't really think you need to necessarily come back on that, but the arguments are convincing for like bringing things together in the future, and I do get all of that. But in terms of whether that's the right site and the consultation on that, whether that is the right site, and you've mentioned a couple of comments here, we've got a long way to go, I think, to bring the people of decorum with you and who we're representing. So even if I thought it was a brilliant idea, I do need to bring the views of my constituents here. Thank you.
Thanks very much. I'm sorry, we have got a long agenda. All right, very quickly, Councillor Mitchell first, then Councillor Jankowski, but I've been
It's
asking
not a
you very
question,
brief.
so it doesn't need an answer.
Okay,
just
very
quick.
briefly.
It's just to reiterate my desire to see 24/7 urgent care and also rehabilitation beds at the site.
Thank you, Councillor.
Yeah, my question was just on the, Diane mentioned earlier, the 4 stages of sort of business case that will come forward as the NHS. Are you able to just outline what those business cases look like, what the future looks like, where we are in the process, and sort of where we are
Would you be
now?
able to do that in writing after the meeting?
Yeah.
Could I suggest that you get a written answer to that after the meeting, because I think that's going to be a long answer. The purpose of the report was to provide the committee with an update on the draft strategic outline case. Done that. Recommendations that members note the report and provide any comments to cabinet. Well, those comments have been made with at least half, it feels like half the cabinet present. And they'll be noted in the minutes anyway. So is that recommendation? Oh, Councillor Whitelow.
I was just going to say, Chairman, that, you know, because of the reservations that I've got to this, I can't support the project currently as it stands, because if we're going to go down this path without having sorted out the parking first, we're actually wasting money trying to progress the project.
And that's a comment that's been made.
And I would like to see that, make sure that is in the minutes, please, Chair.
Yes, that'll be in. I'm sure it will be in the minutes. Any other? Is that agreed? Agreed?
Agreed.
Thank you very much.
It's a no-brainer.
Thank you. Councillor Keane.
Right. If we're happy to move on to item 6, garage business plan. Hand over to Steph.
Thank you, Chair. So the document is a very important document. Really proud to present the document. Quite a lot of work went into it. It's a strategic 3 years garages business plan. And the aim is for the plan is to set up the strategic direction, providing a clearer operational and financial framework for the management of our assets. I will pass it to Ian for a very brief introduction on the summary of the key points of the plan. And then Karen is here to respond to any questions if there are any technical questions.
Thank you. Good evening. So what we're seeking tonight is for the committee to note and endorse the garage business plan and to provide comments on the garage business plan prior to it being submitted to Cabinet in December. So this is a new business plan. It sets out the strategic direction for the garage service from next April through to March 2029, and it's been informed by service reviews and operational insights. There are 4 kind of overarching objectives and goals. One is optimising occupancy and revenue growth. This is an important source of income for the council that helps maintain services across the council. Enhancing customer service, engagement and retention, strengthening our operational efficiency and maximising the asset value. So just a bit of background. At present, the council has 7,093 garages available for rent. This will reduce because there are some other work streams around strategic asset review and repurposing of some garage sites that's been undertaken by colleagues. But as I say, it's a significant income earner for the council. So in 24-25, we had annual income of £3.7 million. Occupancy is roughly at 77%. We've got 256 garages that are available and ready to let at present. And it sets out that. I mean, the key improvements that we'll drive through this. There is a 2-year part-time post aimed at increasing those lettings and marketing the service better. There is digital platform that will be rolled out shortly, which is quite a key improvement to the service, and that will allow customers to do a lot of transactions online and a lot of self-service, meaning they can do it when they're at home in an evening. Obviously, it's quite difficult at times. The service operates primarily 9 to 5, Monday to Friday. A lot of people at work, so that will improve that as well. And as part of the service, we're also proposing to create a 2-person handy team that will go around and can do some basic repairs to garages, but also start doing a little bit of maintenance on forecourt. So we're quite a reactive service at present. So if someone complains about litter, overgrown vegetation, we're reliant on clean, safe and green. So we want to be a bit more proactive and tidy up these areas to the benefit of garage tenants, but also those people that live locally as well.
Questions? Councillor Supplementary.
Thank you. You mentioned a couple of times in the report about the fact that charities and community groups aren't currently charged, and I note that that has been kind of tabled for future discussion, but it also is noted that that's one of the risks is that we don't later on decide that we will reinstate those charges. So just a couple of questions on that. First of all, when have they always not paid, or is it something that was suspended at some point? And also, assuming that charges are reintroduced for them, would we be looking at a reduced rate for charities and community groups, or would they be charged the same as other tenants?
So some of that detail's still to be decided. So if anyone new that wants a garage now has to pay, and they pay full rate, but there are a lot of historic garage that are with, there are roughly 38 charities, which were probably quite well-known charities, scouts and guides as well. So, but yeah, I mean, we'll be working. Obviously, we'd like to introduce charges, but realise that may not be possible. There may need to be some kind of stepped process. If we're going to introduce full charges, does it need to be stepped over a number of years? There's a lot of detail to be worked out. What we have done as part of this exercise, and Karen's done a lot of work, is we've contacted every one of those groups that were claiming free charitable garages, and so a lot of them have had charges reinstated, because it turns out the original people that had the garage weren't actually the people that were now using it. So we've done a lot of work on that, and we're much more assured now of who's got garages and who have had garages for free that
Shouldn't have done.
yeah.
Okay, thank you very much.
Councillor Deacon.
I quite enjoyed the report, so thank you very much. I'm surprised I got excited over garages, but I did. And it was, and I think it was way laid out, and I think it's a no-brainer. It looks not much risk for an opportunities for some extra revenue. The only thing that I would have expected to see, though, was a list of those under the potential repurposing. Because I would imagine that you've been very specific with the number. So and a question I have is, where are they? What would they be repurposed for? Would those decisions come back to scrutiny before that happens? Because I think that's the only one contentious part I can see.
So that's the bit of work that, while we manage garages, we are involved in, but we're not. It's been led by other people as part of the strategic asset review, but we can feed that back. I think there is a long list of sites, but no decisions have been made yet. Some of them will be retained within our, that's what I'll call our garage management, others elsewhere. But I mean, we can certainly feed back around when decisions are made, what they may be. So.
Thank you. Any other? Councillor Tibbs?
Thank you. Yes, thanks for a really detailed and very long and detailed report. It took me some time to get through. One or two things I'd like to mention. One is you're repurposing garages, a lot of them. What are you repurposing them for? Because the majority of use, I notice, is just for storage, more so than cars. On the other hand, if you put a car in them these days, they wouldn't fit, because cars are much bigger. And also, I seem to remember, not in this report, there was talk of sort of offering them as possible workshop bases. People could convert them for use as a workshop in order to create small businesses. At the moment, they're doing that in Cubic Green Lane on the field. But, so I'd just be interested to know a bit more about that. My other thing is that you mention primarily, you're talking about the sites in Hempstead, Berkhamsted and Trent to an extent. And you mentioned very casually a few sites in the villages. I represent a lot of the villages. I'd like to know what sites you're looking at in the villages. Especially we do have one or two that are completely abandoned. And I think there's opportunity there to do something different.
So this plan is looking at what the council's classified as retained stock. So the repurposing is outside this business plan. As I say, it's not a bit of work. We're involved in it, but it's not a bit of work that we're leading as the garage management team, so to speak. So that we need to speak to colleagues in property and in commercial development that are leading that bit of work. But some of the things you mentioned around how they could be repurposed are exactly what they will be looking at as part of that bit of work. So what we're seeking to do through this management plan or this business plan is those sites where they are still primarily used for storage and garages if you've got for a car, if you've got a pretty tiny car these days. So
It says that 60 garage sites have been identified for potential alternative use, and that is not you then?
no.
Okay.
It's funny actually that the more you put into a report, the more you stress that you're not dealing with the disposals, the more questions you're going to get on them. My only question was going to be in relation to the ones holding on to, the ones that are in the worst condition and require the most work. There was quite a revolutionary, if I can call it, idea I heard many moons ago about simply demolishing the garages and to convert them into parking spaces. So they carry on, you're almost forcing them to be used for the purposes for which they were built, and saving yourself the cost of having to maintain the actual building of the garages itself. Can I ask, has that been included in the considerations at all, or am I being too?
That's not within the garage business plan.
Right.
But it is something we've had discussion on from our cabinet member who is
something I've been raising regularly, that we need holistic thinking, and we need to think systemically and have policies that where we have lots of things going on which overlap. So we've got the electric vehicle charging points, and we need more bicycle storage. We need and we have the parking stress. So there's big problems caused in the past where houses have been built on these what were parking areas surrounded by housing, and the architect obviously intended the cars to go there, and we need to bear that in mind now that we're having situations where the residents just can't fit their cars into the streets, where and we're having to do the parking solutions where we tarmac over. So we need to consider these things holistically.
Maybe that's something we can come back to in the long term. Sorry, did you want to?
Yeah, I was picking up on that point. It is something, whilst parking has not been included in the business plan, certainly my role going forward, I will be looking at these sites individually and those that we are retaining, and where we can potentially remodel some of the sites depending on cost as well. We will look at that as well to see if we can remodel sites in terms of being able to provide both parking and storage solutions. So it's something that I will look at.
It costs money to demolish.
Absolutely.
I'm not so much for non-realistic. I don't appreciate that, but hopefully that's something long to step.
So yes, I just wanted to just touch a little bit on investment, because that's probably what your question was in terms of what do we do about some sites that need investment, and there is a piece of work that we are continuing to do to see how investment could be worth it or not on those sites. I think that there are some obviously questions about return on investment and understanding at what point that investment is worth it or not, and there is a piece of work we're doing in relation to that, and we need to understand on those sites that require investment, what do we want to do about that. So that will continue.
Thank you, Councillor Hobson, and then Councillor Mitchell, and then we'll wrap it up. And Councillor Stevens.
One comment and then one question, or whether it might be something just for you to take away. The comment is excellent report. I think it's a really important asset that we have. You've thought about it really thoroughly, and it's good to see that it's although the small deficit, that it is mainly financially sustainable. We should be doing all of the things that we can. And just a couple of point to talk about EV chargers, but I was just wondering, with the garages, would you be able to get more rent if some of them had electricity, at least for lighting, particularly as the winter comes in? Trying to find things in my garage with my phone torches is a bit of a challenge. I did think I could just get a battery thing and charge it, but that's just and then you could obviously charge more for those and/or which would include electricity. Just a thought, because some people might be able to do some legal things in there. And I did have another comment, but I can't remember what it was. Oh, whether or not I can't remember, because it's a very long report, and I apologise if I missed it. But if there was any consideration to more short-term lets, if somebody is moving house and they just need to use a garage, particularly at the more of an online interface. I don't know if the online stuff is just for the asset management side or whether it was the customer liaison. But you know, if I've said this before at the meetings, you're in competition with the big blue storage, which is astronomically expensive, and you guys are really good value. So just a couple of thoughts, really, electricity and shorter term lets. I don't think you have to answer that potentially unless you want to.
Yeah, we already offer short-term lets, so anyone that's signing up for a garage tenancy only have to give a week's notice now, but it's something that we will promote more because it's part of the report, I think, mentioning in there about marketing and making sure that we're getting that message out to those customers and members of the public. So it's actually a valid point, but yeah, we do that now. Thank you.
Councillor Mitchell.
If we do look in the future at turning any blocks into car parking areas, will we do some sort of thorough consultation? Because I don't know if Gators just has people with small cars, but I've got a lot of residents that do actually use them for the purpose that was intended originally.
I mean, where there's good occupancy, we won't. That's looking at sites where occupancy is low or the garages are probably in a state of quite bad disrepair, notwithstanding, as Councillor Anderson said, there's quite a significant cost at times to demolish and level the area and make it secure as well. But yeah, we wouldn't do anything without consulting residents, and it's certainly not looking at those sites where there's high occupancies.
Councillor Stevens.
Right, thank you. Thank you. It's a very informative report. Thank you very much. My question comes back to, I suppose, the viability here. In your opening paragraph, financial implications, you're showing a net 2.2 million in 24-25, and you're telling us that we could be into deficit in 26-27. How come?
That's because, yeah, there's a part-time post that's in there to kind of, I suppose, we are speculating to accumulate. So, but we are seeking whether we can fund that outside from the garage service elsewhere as well, so which would then take away that immediate deficit. So,
Okay, right. Against that, if we're making 2 million net,
yeah,
I don't think a part-timer is going to take us from 2 million net down to minus 26 or minus 6 rather.
Yeah.
Sorry, I think the deficit is only in relation to the additional income that can potentially derived by our business plan. It does not take into account, we will still continue to be in net surplus. So the deficit is only accounting the business plan, and it's only in relation of the business plan.
So it's the incremental that we're talking
Yes.
about, rather than the net incremental.
Yes.
It's the variance to the medium-term financial strategy. Yes. There you go, I found the page. Yes.
Thank you.
Just in the there being no other questions, the purpose of the report was to present comment. The recommendation is to note and endorse the Garage Business Plan 2026-29, to provide comments on the Garage Business Plan prior to submission to Cabinet. Again, I think we've done that. Is that agreed?
Agreed.
Good. Thank you very much.
Thank you.
Item 7 and item 8. Item 7 is the Arts and Culture Strategy. Item 8 is the Active Wellbeing Strategy. Diane is going to give a presentation that relates Both?
Well, an intro presentation might be a bit grand.
All right. Whatever. In one go, and we'll take questions on the art and culture one, and then do questions, and then do the wellbeing one.
Thank you. Yeah, just to expedite, because the intro relates to both. The team here have any questions on the specific strategies and the contents thereof. So following on from tonight, this will be going to Cabinet. The reports will be going to Cabinet beginning of December for approval. I think to note that we did present these strategies to Health and Wellbeing Committee last evening, because a really important point about both of these strategies is the links to the health and wellbeing of residents and the benefits to the general health and wellbeing of our residents. And I think it's fair to say they were both very well received yesterday evening by Health and Wellbeing Committee. I do feel it's worth just drawing out in terms of the engagement that's been undertaken. It's been a journey, shall we say, to get to the draft strategies that you see, but there has been extensive engagement. There's been online surveys, there's been stakeholder groups working with partners and the various sectors, as well as all member briefings that were offered earlier on in the year. So a significant amount of engagement has helped shape both of these strategies and responding to that engagement. And adopting these strategies does allow us to apply for funding, external funding, as and when it should become available, and helps us to support any funding applications with more structured approach and evidence. So I think they were just the key points that I wanted to bring out. Taking the reports and strategies as read as usual, but a couple of really important points I think that apply to both strategies. So I don't know, Chair, if you want to take questions on each strategy in turn, or just as you feel fit. Or we can take them together, each member. Or
can we just move on? Has anybody got any questions? So Councillor Timmins, please.
Thank you very much. Once again, a very detailed report, and I'm very supportive. I'm going to talk about the first one, arts and culture. I'm very supportive of arts and culture. I think it's great, but and it does have obviously positives for health and well-being as well. I have one or two things that I'd like to mention on the report. On page 60, 1.3, it mentions, I'll quickly find it. Second bullet point set out how arts and culture will benefit council priorities, e.g. health inequalities, and then placemaking. What is placemaking? That's my first question. And I also noticed in a lot of the surveys and things that you did, there's a lot of people referred back to the pavilion. So obviously, a lot of people couldn't identify anything much else. And I think the pavilion also, I can remember taking teenagers there for their sort of events that you had. And I think that's missing now for a lot of teenagers. And I think that is something that would be great to have again. Because there's nothing in the villages, there's no youth clubs, all those sorts of things. I think that would be something that should be considered. I also noticed that your surveys tended to be older people rather than younger people. But I still think that all of it in general is a very good, positive thing to be looking at and doing. My only other thing is, and I sound like a record here, is it's very centred again on Hemel Hempstead and to an extent Berkhamsted and Tring, but not the villages. You know, people don't have the same access, but the villages do have their own events in the church and this sort of thing now, which is good, but I don't know how much support actually comes from Decorum for that. So where you're giving a lot of support and looking at this from the point of view of Hemel Hempstead, I wonder how this can be also supported within some of the villages and further out areas. Thank you.
So if I can just start off with a couple of broad responses, and then I'll hand over to Diane to talk about some of the detail, particularly in relation to the last point. And I think this point around placemaking, actually, I should have covered off in the introduction because it does apply to the active wellbeing strategy as well. I think a really important point is how both of these strategies work with other strategies and initiatives across the council. So Diana and Chris, for example, have been very active in terms of the Hemel Garden Communities programme and ensuring both of their fields are represented as that programme is developed, as well as with the local plan team. And in terms of the arts and culture, as an example, things like a public arts framework. So placemaking in terms of this isn't just about bricks and mortar, it is about a broader aspect around arts and culture. So it's how it fits in with the delivery of the town centre vision, the delivery of the Hemel Place strategy, as I said, Hemel Garden Communities, the local plan, and how those disciplines are represented and feature in all of those initiatives, rather than just being constrained by the narrow definitions of arts and culture. It is making sure that it's represented more broadly in the activities of the council. With regards to the pavilion, yes, you're right, it did come out in the engagement, it came out in a number of ways. And you'll note in terms of the high level action plan, there is reference to a feasibility for an alternative venue, which gives us the scope to undertake that if it's deemed appropriate for us to do that on the back of this strategy. But that will be a decision in terms of moving that forward that will need to be taken.
Market Square might be a good decision.
And then I'll let Diana speak more about this, but this is a strategy for the borough and not just Hemel Hempstead, as they both are. But I think Diana probably can add to this in terms of how that broader engagement with the other areas outside of the three main towns.
I feel this is, not mentioned.
Yes, so to take that point first then, in terms of the Hemel focus versus the other areas, in terms of the engagement work that we did try and promote the survey as widely as possible to all areas. So it went out to some of the local community libraries as well as online. But we did find that the majority of responses did come from those main towns. So
do you have any representation?
We did, yes, we did have a mix from the villages as well. And yes, it's something that we're very much aware of. For example, last summer we had a micro grant scheme where we had a showcase of decorum creative activity, and that was very much promoted across the whole borough. We did have some quite good uptake from some of the outlying villages as well. I know Mark Yates did a project in a local church that had an art exhibition there. So we are looking at ways that we can make this borough-wide as much as possible. That being said, obviously there is a push on areas that kind of could benefit most from support. So some areas, they're doing a lot of creative activity already. They've got a good voluntary sector going. We've got only a finite resource, so we do have to look at some priority areas. So that's why Hemel does come up a little bit more, but very much the aim is to spread this far and wide. I think it's also about supporting the creative sector. So again, we can't deliver all of this. We very much are about working in partnership with local community groups who are able to deliver, and that could be in the villages, it could be in the towns. There's a lot of grassroots community activity going on across the board, which I think came through really strongly actually in the consultation, and it's something we need to shout about more. So I think part of it is more around the promotion side of all the excellent things that are already happening, and just making those a bit more visible as well. So there's definitely things we can do for the more rural areas.
Thank you.
Just to address your point as well around the age groups, the younger people. Again, it was quite interesting that the response we got to the survey was skewed towards older people. And we've tried to be a little bit mindful of that in interpreting that data, because heritage came up as a very strong interest throughout, and we were aware that that may be a reflection of who was responding to the survey. But hence why in the strategy we have identified young people as a key target group, because it became quite evident that there is a bit of a gap there in terms of the provision, particularly for that sort of teenage, young adult sort of demographic.
This sort of thing,
Exactly. So that has been identified as a priority group. And again, it's about working in partnership with other organisations that might be able to deliver some activity, not necessarily in a building, but in lots of different ways. So that could be technology, it could be digital, it could be quite innovative. It doesn't necessarily have to be one single venue. But yes, so that's why young people is definitely a target for us to work with.
Councillor Gale, bring up your brass band.
Thank you, Chair. Well, again, I always trumpet about the brass band, and I feel a bit silly declaring it as an interest because I'm not sure whether it's really that relevant. It is an interest, whether it's a.
I'm having to miss my own rehearsal tonight to be here, so I'm with you on that.
Just a couple of observations. I think that I suppose the harking back to the pavilion fits in with the slightly skewed cross-section towards older people. Older people will remember the pavilion, and so they'll all bring it up. And it's sad that we haven't had anything like that going forward. But I am a strong believer in looking forward, using the past, but actually looking forward. And it seems to me the other thing that I took from this is that we have a really good institution in the Old Town Hall. Which seems to be very popular, very good, very well run, really good, but just the building seems to be completely unsuitable. I mean, it's too small, and it's and so putting that together, it would seem that we want to retain that institution, but have it move it to a more suitable premises, more convenient premises. So that might be a way. Rather than having a new premises which competes with the old town hall and causes tension, actually support the town hall and have it build it up. So that's just an observation on that. Question, curious about the Arts Council. Why have St Albans got 13 at page 95? The funding awards. Decorum doesn't seem to have benefited very much from the Arts Council compared to others, and I'm just wondering why that might be. How have St Albans got these 13 grants, and how can we get some more grants from them? I can see that there's we're going to build up a relationship, and we're looking for funding, but are we looking at other parts of the world and seeing how they do it and see whether we can compete?
So, I mean, there's probably some more detail to that, but I think we should remember perhaps that the post and the service hasn't been in existence for particularly long as well, in order to be active in that. And as I said at the beginning, adopting this strategy will enable us to support those funding bids as well.
Yes.
So I think those two things in parallel, having as we said at the time when we created the place, communities and enterprise structure, the importance of arts and culture has resulted in the fact, and communities and leisure is the fact that we've got those heads of service as part of the structure of the team to enable that to be better developed and delivered.
That's great news. So that's very helpful. And the St Albans, do we know, I mean, have we looked at that anyway to see?
So there's probably a number of factors there. So Decorum does not have any regularly funded organisations or MPOs, which are tend to be your bigger arts centres, museums, etc. We don't have any of those that would get regular funding from the Arts Council.
So it's things like Verulam Museum and things like that?
Yes, or for example in Watford, the Palace Theatre, etc. So it tends to be they are more well known to the Arts Council because they've got a relationship with those organisations already. And then, yes, again, there's been no one to support the sector to put in those funding bids. It's quite a competitive environment. It's getting harder and harder, particularly in areas that are perceived as quite affluent, to get that grant funding. The priority areas for Arts Council at the moment tend to be areas that are kind of have more deprivation issues, etc. Obviously, we do have that here. We have pockets of it, but we're not a priority area for the Arts Council, unfortunately, which does make it more difficult. But yes, there's a lot more I think that we can do in supporting external organisations to apply, and then also working in partnership to put in our own funding bids. So that's why we need the strategy, because without any strategy at all, the Arts Council just won't even look at these funding bids to start with. So yeah, and that's why they also want to know we've done the consultation, we've done the engagement, and we know why we're applying. So hopefully going forward, we'll be in a much stronger position to apply.
It's a reputational thing, is what you're saying. We need to have a
Yes,
reputation.
it's building up a track
We need
record.
to be a bit more lovely.
Chicken and egg.
Yes,
But
absolutely.
there are lots of other things out there, so we're not just going to be relying on one source of funding. We want to try and look at diversifying that and looking at individual donors, much broader grant funding opportunities as well.
I need to move this on. Councillor Mitchell's next, and then Councillor England.
That's
And then I'd like to wrap it up, so
So thank you for producing the strategy. It's something that I'm very supportive of. There's definitely a strong appetite for celebrating heritage, and I think the Open Heritage Day at the Roman Villa recently demonstrated that. I believe it may have been sold out, but it certainly, went down very well. It was a fantastic event, and I'd like to put on record to thank Clean, Safe and Green for their help in making that happen. At the moment, there isn't even an information board there. There's nothing to show that it's there. So lots of people, even people in Gadebridge in the ward that it's in, don't realise it exists. So I would support an increased focus on heritage. I'm glad you mentioned youth. I have a teenager who sings, and I could not find a singing group anywhere in the area. So it'd be really good if we could support that more. And also street art. I'm quite interested in street art, and I see that Amersham Town Council do a very good job with that. They have projects where they've decorated telecom boxes, so they're not the ugly box that you see on the side of the road, and they actually look really quite fantastic. So that's something that would be good if you could explore the work that they do there. And that's me done. Don't really need to answer any of that if you want to move on, but thank you.
Yeah, just on the last point, we are developing a public art framework which will look at all different kinds of art, so not just street art, but that can be temporary events, it can be a wide range of things, and looking at how we can promote that more widely. So that's definitely on the radar.
Councillor England, briefly.
Yeah, try and be brief. I want to say a big thank you to Diana and to Chris. I don't think we'd be able to be here tonight talking about this kind of work without the council having first hired them. And talking about the pavilion, which is one of those themes that's been talked about for years and years, as long as I've been involved in any of this. You can't just do something like that. It takes, I think somebody said a minute ago, you have to be a bit more lovey. You have to establish that reputation as a place that wants to do something. And the first part of doing that is putting the structure in place, as Diane said. The second part of that is what we're talking about tonight, these two strategies. And the crucial thing about these strategies, as Diana has just said, is that it enables us to go and bid for funding. If we begin to bid for funding and we build up what we have, and we build up the creative and the arts and culture potential that we have within I say the borough, but I mean the habit these days of saying the towns, the villages, the rural parts, all the people who live in this area, then we can start to think about putting a plan together for something bigger. But the answer to the question, why hasn't the pavilion been rebuilt, is because we didn't have anything to build it with, culture-wise, and now we've got the foundations.
Thank you, Councillor England. I agree with colleagues that it's important when one looks forwards but one also needs to look back to inform one's looking forward. And quite a few comments have inevitably been made about the pavilion. The reason why the pavilion failed was because it could not compete with living close to London. It became extremely expensive building to run. I seem to recall, I think the only performing act we had in the last month of the building's life was Otis the Aardvark, which kind of, without being unfair on Otis, it kind of illustrates the kind of acts that the venue could attract. It was a real problem, and that was the reason why, sadly, we lost it. I support 100% us having an arts and culture and heritage strategy rolled into it as well. I think it's excellent that we have a formal strategy to collate everything to do with the arts and culture and heritage. But I think it's also important that when looking at facilities in the future, that one tries to get the right facilities for the right performances or acts, is what I'm trying to say. So the Old Town Hall was mentioned earlier. Yes, it's small, but why not market that as being a small niche venue? You know, that's a classic example where I will say hand on heart, for some years, the council didn't market the venue as much as it could have done. And I do think that's an opportunity perhaps for the future going forward. But as has been said, you can't do that unless you've got a strategy. And I think this is an excellent step in the road of progress on this issue. So with that comment, I would like to, I think the recommendation that the draft arts and culture strategy and high level action plan are presented to Cabinet for approval. Does the committee agree with that, endorse that? Is that agreed?
Yes.
Fantastic. Thank you. That's the arts done. Chris has been sitting here very patiently. For goodness knows, would you like to say a few words about the sports one?
I think the title is really quite important. We've gone from having a sport and leisure strategy to a sport and active recreation strategy to an active wellbeing strategy. So it's very much in line with the way that Sport England, the NHS and adult social care are moving. So I think if you look at the 3 or 4 themes, it looks at facilities, it looks at activity programs, it looks at the active travel, active environments, and how we will link in with the wider health and wellbeing agenda. This is sport and activities contribution to it. We're not solving all of the NHS issues. This is about sport and activity, and I think that's important to recognise that. One of the things we mentioned in the strategy is that whilst we have 3 leisure facilities that the Borough Council owns, the vast majority of sports facilities are based within education sites, and therefore the community use agreements we've got with the high schools and the primary schools to ensure that those community usage in the evening, weekends and at the school is continued. So I think it's important to place the leisure centres in an ecosystem, but also alongside that, there is the parks, the open spaces, there's the blue and green therapy that wraps into that. So it's very much looking at a whole systems approach if you take on board some of the conversations from earlier. So this moves what's traditionally been a sports and leisure strategy about gym swim classes into a much more corporate, higher level document that where the authority can bid for funding and link up with some of the push that's coming through around, you know, the World Health Organization now recommends strength and conditioning and cardiovascular for older adults. So if councillors look at the campaigns that we're going to promote, whether it's Live Longer Better, We're Undefeatable, This Girl Can, they're all aimed at those communities that we can push and encourage people to become more active. But we also recognise there's price points. The health walks are free. There is a park run is free. If you want the gym membership, you can go to Nuffield Health or you can come to Hemel Hempstead. So there's a number of different component parts moving in with this ecosystem that we recognise that people have price points and where we can support them both from adult social care through to pre and postnatal classes. So I think that's where we are at.
Any questions on Councillor Tim?
I really do think you'll talk about sports mostly, a lot of it, and I really do think that should be part of the title. I think it should be sports activity, health and well-being, something like that, because I do think that's what it's principally looking at initially. The other issue I'd just like to mention is that you're talking about inclusion and getting people who may not be as active as you'd like them to be, shall we say. I'm just thinking that for certain cultural groups, certain groups who are less active, something like cricket, for instance, is a very good way of getting both girls and boys, but particularly girls, involved. And I say this as in the villages we have cricket going on and football. We don't have quite the same resources of swimming pools and things available, but we do have cricket and football. And the cricket, we'll often find we're playing with teams, multiracial, shall we say, teams and everything, girls. And I think that is something to be encouraged as a sport and so on. The other thing I'd just like to mention, I think it's part of this on page 160. Which is people and place. Is that part of the health and well-being?
Yes, I think that's pretty much looking at the population of the borough.
It's talking about being an aspiration, to recall being an aspirational place, close to the capital, excellent standards of education, etc. And proud to be the home of 85% of the world's extremely rare chalk streams, River Skade, Bulbourne, Ver, and Chess. Now, I know you put a lot of, with the Environment Agency, effort into the River Gade, but in my area we have the River Ver, which is heavily polluted in our section by Thames water and so on, and the place, and it really needs sorting out. So if you're proud to be the home of that, I'd hope you would put some resources into looking at the Ver, improves the Ver.
I don't think we cover this in this strategy, councillor, but I'll talk to colleagues in different departments.
We'll part of that with Steph.
Thank you very much.
Thank you. Councillor Mitchell.
I just want to say that we've recently been approached by Grassroots Football Club and Hemel, and I was just wondering, they're looking for grounds and a clubhouse, and I was just wondering what we can do to support that, and if that fits into the strategy in any way. I'm really keen on Hemel because they are really strong in supporting girls in football and also send football teams as well. So I'm not going to just single those out. Obviously, there are other clubs. I think they may be one of the largest grassroots.
We're in discussion with Jamie and the management team at Hemel, yes.
That's great. Thank you.
Right. If there are no other questions, I think as the two items went very much together and involve many of the same issues in terms of having a holistic strategy to guide the way forward. Are members supportive? Agreed? Agreed. Thank you very much indeed. Next item, if I can get the words out correctly. Technically, environmentally, economically, practically, assessment. Is Ian, Steph or Ian, which one of you?
This report, as Councillor Anderson has said, is a Teep report. It's a little bit of an administrative thing that we need to do, but because the way the council collects its recycling, as in its commingled, dry and mixed recycling, as opposed to collecting paper and card separately, which is what simpler recycling legislation dictated. Because we don't comply with that, we need to do a Teep assessment, which is what this report is, and it sets out you can do one element of the Teep, but we've done all elements of the Teep, so we've got a robust business case for basically continuing to do our recycling collection as we do, which is commingled, dry and mixed recycling, as opposed to separated, which if we separated, we need to completely redesign the service, probably buy additional vehicles, get additional staff, and fundamentally change the way we do it. We're not alone, so there's roughly 330 local authorities in the country. 200 plus are still collecting recycling as we do, so we're with the majority. I say it's slightly administrative, because if you don't do a Teep Teep assessment, you could be fined, albeit we've not found any evidence of anyone that has been fined, but that is an option that's open to DEFRA. So, this is brought this report here before it goes to Cabinet, who will hopefully approve and endorse the Teep assessment that's been done, so we can continue as we do.
No, I've got one comment, but after you, Councillor Santoro.
I'm happy to take a written answer on this, and it is slightly outside the scope of the report, but since you're here, do we know where the recycling goes after it goes to the depot in St Albans? We do. Ooh.
Oh, after it's been to Pierce. Robin may know, he's been there recently.
Well, the food waste goes to the anaerobic digester. The mixed recyclables goes to Pierce in St Albans, and we went there a few weeks ago.
After that,
and then those materials, when it crosses the threshold, it becomes their property. So it's actually their business. But with the Hertfordshire Waste Partnership, we do get some feedback on where it ends up. And a lot of the cardboard goes to China because that's where we buy stuff from. So it gets recycled into boxes to come back. The glass and plastic are pretty well recycled. There's some film and stuff which can't really be recycled, and that ends up going to the energy from waste. I mean, there's a lot more detail if you're really interested.
I mean, this question, Chair, this question has come up several times in the past, and I had asked if we could have a investigation, an inquiry.
Steph, do you want to comment on the committee?
Absolutely. So, as part of the scrutiny review, we've agreed that we were going to do an in-depth report about waste and clean, safe and green, about the cleanliness of the boroughs, etc. And I've discussed with the chair, and I thought it would be quite an interesting subject to include in that deep dive report, to let you know where the waste goes and what happens to it. So we can include that as part of that report when it comes.
It's not being forgotten, believe you me.
Just raising it, that wasn't a criticism.
No, I mean, I think everybody 100% in support of this technicality. I'll just leave members with a footnote that when we brought in the commingled dry recycling, whenever it was, I did grumble somewhat because I still really want this dream of copying Austria, where I think they've got a 6 or a 7 stream collection, where at source residents are separating their recycling into 7 different streams, and I've often thought that would be fabulous if we could achieve it. But at the end of the day, the realism, people haven't got room for 7 bins, and you do require a lot of participation. So in the end, I just had to lump it. Steph, sorry.
Yeah, I just wanted to add as well, there is we've got a contract with a facility that collects our commingled recycling, and that facility has got very, very sophisticated methods of then separating the material, and it does it very, very effectively. We've got very, very little residual waste as regards of after all of that from the commingled, so I think...
Agree, but having said that, the paper industry are always lobbying for the paper to be kept separate because of what happens to the paper.
Yes, but I think the level of, we've been reassured that the level of quality in terms of the separation is very good in relation to the quality of the material that then gets sold.
Having been under directions to stop people waffling, I'm doing it myself. Is that agreed, everyone? Agreed. Agreed. Fantastic. Thank you. Next item. Item 10, Affordable Housing Supplementary Planning Document, SPD. Ross, please. Yes, please.
Okay, thank you, Chair. Good evening, everyone. So this evening, the Interim Affordable Housing Supplementary Planning Document, SPD for short. And this is the revised draft that will eventually make its way to Cabinet in December, following around a consultation and various updates. I appreciate there's quite a lot, the report's not that long, but the appendices obviously are quite substantial, including the summary of the responses, of which there were 20. The actual revised SPD itself and then just some updates in terms of what the main changes were in an EQIA. So very happy to take questions. In very broad terms, this effectively provides us with the kind of stopgap between the period we're in now, when we're looking at development that provides affordable housing, and when we get to the other side of the local plan adoption, which hopefully will be some point early to middle of the part next year. So this just tries to firms up our kind of negotiating position when we're talking about affordable housing, and it's supported by updates to the National Planning Policy Framework that's happened over the last year or so. We've got colleagues here, John Chapman from our planning policy team and Vicky Stawson from our housing team. So if there are any questions of a really technical nature, then they should be able to assist, hopefully. But I'll leave it there. Thank you.
Councillors? Okay. Councillor, I have got a comment, but after you, Councillor.
Yeah, just for clarity, because whenever we talk about affordable housing, we always think, fantastic, yes, let's have more affordable housing. I think it's just really important to point out that an SPD can't create a new policy on affordable housing. So what this is doing is making the best of the situation under the policy we have at the moment, considering that the NPPF, National Planning Policy Framework, has changed. I think this is just my opinion, but I think the team have worked quite a marathon for the last few months, getting through Reg 19, getting off to examination now, and so I think it partly possibly reflects the fact that bandwidth is a thing, and it's necessary to come to this now. And in a perfect world with a massive team, it might have been done in the weeks following the last NPPF. Having said that, there might be another NPPF by Christmas. So.
You've kind of preempted the comment I was going to make as one of your predecessors, that I'm aware of the amount of work that goes into this very technical area, and grateful for it. I think I seem to remember updating it twice when I had the role. So it's a thing that gets updated regularly because it has to mirror government policy. But I think it's a crying shame that we've lost starter homes, or maybe starter homes in a perhaps a better implementation might someday work its way back into it. But I do want to pay tribute to the effort put into that. And I think without any, there's a question, Councillor Gale.
So I think there's a question as you're here, and there's nobody else asking a question. I'm just wondering, just curious as to how this supplementary planning document it can be used to encourage alternative transport, public transport. Does it play any role in that?
Probably not directly, no. There's probably other policies in the existing local plan or within the NPPF that would kind of dictate those types of things. This is more about the actual kind of housing tenure and the dwelling mix, as opposed to kind of the bigger development aspects of things.
So it's actually just this focuses on the houses, so it's not on the neighbourhood or the way they're...
Not in any great detail, no.
Yeah.
Okay. We don't have any members of the public present, I don't think, apart from one who knows this more as well as I do, that we have to make sure that as councillors, when we talk about affordable housing, we're talking about low cost housing for rent, low rental housing. We're not talking about houses being affordable to buy. And that's quite a key distinction that has to be made over and over again, particularly at Development Management Committee.
Absolutely, right. Could I just make an observation? In the community engagement bit, there's lots of references that have come through from the RSLs. And it's very interesting to see that regularly they were saying social housing rent should be at 65% of what is open market rents. Whereas under the government's definition of affordable rent, it's 80%. Now, in this part of the world, 80% isn't going to be available and sensible for people on the sort of normal incomes in this part of the world. So 65% is probably where we've got to aim what you call starter homes, but what in the old document was called first homes. And I think somewhere or other, I think we've got to bring that out in the future SPDs or policy. Because I don't think people understand that we have a different definition of affordable homes for rent in this part of the world. And it's not the national government level.
Just to clarify in terms of the different types of rent. So there's social rent, which is your very traditional council housing, which has rent levels that are much, much lower, probably around about 40 to 50, yeah. And then you've got the affordable rent, which the government definition is 80% of market rent. In Decorum, we have an approach whereby for 2 beds particularly, we push for that being down to 60%, and that's kind of reaffirmed in the SPD on the basis that we're trying to make them a little bit more affordable. But yeah, appreciated that they're still quite expensive.
Yeah, and we also have the affordable home ownership aspect of that as well. So we had sort of first homes imposed by the previous government, but we've now we're not required to do those anymore. So they can still come forward, but we don't necessarily have to ask them like we did before. So now we're back to more of a shared ownership tenure for affordable home ownership. So a lot of the product that will come through will be the rented side of it, because that is where, you know, we've got the housing register, that's where the greatest housing need for the council lies. But there will be an element of affordable home ownership which will balance that up for registered providers, make their business plans work, really, to have a little bit of a combination of the two.
I think perhaps one other point to bear in mind is that if we go for rents at 60% of market value, that might make some schemes unviable. So there's a tension between trying to maximise the amount of affordable housing and trying to make sure that affordable housing is really affordable to people. So often there will be a need for schemes to have a detailed viability assessment too. But I think our general feeling, Vicky, isn't it, that it's more important to get the right type of affordable housing and the rents right, rather than to maximise the percentage of affordable housing.
Yeah. Not setting people up for failure by charging those high rents in the first place.
To have some of the right amount, right affordable housing than having none of the wrong ones. Anyway, whatever it is I'm saying. Right, as the committee, I've forgotten that. Oh, hang on, I missed that. Councillor Timmis, please.
Thank you. I noticed there's reference from the to rural affordable housing, and that you're looking at this as some part of the thing. So I'm just wondering whether there'll be any, I don't know, it's emphasis, or they'll be making sure that they fit into the rural look, rather, because an affordable house, one assumes, is something that is pretty basic in its looks and so on, and whether when you're putting it into a village, whether there's any attempt to make them look more part of the village and not too separate, as it were. I mean, we do already have some of the villages have what used to be called council houses there. And I'm just wondering whether with this, talking about rural locations, including areas of outstanding natural beauty, which quite surprised me, that you'll make sure that it will be made sure that these houses are appropriate in that area, and also who will be building them.
Assuming there's some mechanisms within planning, but certainly when it comes to rural exception schemes, so schemes that will be very much for the local people, they are quite often done by housing associations that specialise in those rural schemes. Housing associations like English Rural and Hasto, who do some very good products that very much reflect the character of the area in which they're built.
It's not always the case, I don't think, but anyway. But I do think there's a great need, definitely, for what I think should be starter homes, really, because certainly affordable in some of the villages won't be very
It's just worth having a look at section 18 in the draft SPD, which deals with design and layout of affordable housing, and that says really the council will expect a tenure-neutral design approach, so it's not possible to distinguish between the affordable and open market housing, and also the affordable housing should be built in clusters, which should not usually exceed 20 homes. So that's quite different from the old school approach of having very large council estates, which look different and had a...
Yes, no, the photos you got, for instance, in the Kings Langley development, it's a much more attractive looking one than the one you've got in Gadsden Road, which looks a bit less attractive when you look at it, and less country, less rural.
Okay then, does the committee, is the revised draft SPD supported?
Agreed.
Agreed. Thank you very much. Thank you very much for waiting for that item. So then on to item 11, let's put 3 ways. 6 monthly performance reports deep dive. Who wants to go first?
Next one, Nathan's. Should I? Yeah, I mean, I think I won't do, for time, I won't do anything with an introduction. I think we should just take any questions on.
You want to go straight through to questions on planning?
If that works, yeah.
Okay, questions on the planning report, performance report? We've noticed we're sadly losing appeals. Big ones. Yeah, we can't do anything about that except try and get the local plan done as quickly as we can. In which case, move on to the second one. Yes, please. Yes, please, consultant. Yeah.
This might be easy for me to say because I haven't really been involved in any of it, certainly not prior to 2019. But I think on behalf of our residents, I think we have let them down. Decorum has let residents down as far as the local plan is concerned. I think we're going off 2013, if I'm right. The current plan. And I believe in 2017 consultations were done and they were progressed to quite a mature stage, and for whatever reason, I don't know, it fell apart. I think that time has moved on. I mean, in another situation, I might like us to have a deep dive into why we have not had a local plan and why we have let our residents down, but it may well be that that would just be a complete waste of time. But I just wanted to make that note. I know there's been a change of administration in the meantime, but
no,
I'm not aware of any strong reasons for why it's taken so long. And I personally think we have let our residents down by not having a local plan. And suddenly all these predatory applications are now getting through. Thank you.
I would say in response to that, that it's not us, it's not the council that's let the residents down, it was the previous government. Reason that we managed to ratchet up about at least 3 Regulation 18 consultations, which might be something of a record, I'm not sure, was because we kept on, government guidance was changing at one point almost on a monthly basis. You know, it brought a whole new definition of meaning to the moving goalposts. It was changing quite a ridiculous rate. We never quite sure whether the house building targets were going to be mandatory is what I'm looking for, or whether they were advisory. We in those circumstances, it would have been extremely difficult, if not unwise, to have actually pushed the plan through, only to go all the effort and then have it thrown out because it didn't actually comply with what the government policy was that month. It was a very unstable environment, and it was very difficult. It was a very difficult period.
Take your point. There are other local authorities that pushed ahead on behalf of their residents, and then if it was then pulled, it would be up to the government. Much clearer cut.
They didn't have the same. They didn't have the same land availability issues that we had. Anyway,
I just think well, whoever's responsible, maybe I started or prefaced it incorrectly. Our residents have been let down, and that's what, and these predatory applications going through, I think is a failure. It may not be our failure, but it's a failure, and I just wanted to say that on behalf of our residents. And I'm really looking forward to this new plan, which I don't particularly like, and I did not vote for, but it being in place so that we can get control again over them. Thank you.
Next was neighbourhood delivery. Steph?
Thanks, Chair. I just wanted to note the report for members in relation to the performance indicators. I also would like to note the achievements in relation to the green flags and the angling bloom. This year we retained all the green flags, so we got all gold for our gardens, and we got a winner as well in the category at Tring Memorial Garden. So we've done particularly well in that respect. And also we've got another award with the animal welfare team. There's been awarded the RSPCA Planning Platinum Award for the stray dog services. So just wanted to note the kind of good news on that. Also to note to the very little number of complaints considering all the inquiries we received, 0.01% in relation to that. Yeah, the rest is really performing quite well. There are also some benchmarking figures so that I hope members found them interesting. Open to questions.
Okay. Yes, please, Councillor Evans.
Yeah,
Something.
I just want to make one observation, which is that, yes, we have retained 6 green flags, but one of those is a relatively recent acquisition. So I don't know whether it's a thing where when you get one, you're a bit nervous in case it's going to get retained, but it has been retained. And I mean, I think the Opera's got 17, so how long is that going to take?
Well, we got Coronation Field next, isn't it? That was on there. We need to invest in some of the parks, but yeah.
Okay, thank you, sir. Noted. Thank you very much. We used to have environmental health. Is that being changed to a different committee or?
No, that's neighbourhood.
Sorry, no, it's like neighbourhoods as well, so that's all. That's included, right, we've done that, cool. In which case, I'll end the meeting at 1:15.